Hey guys, Dr. Eric here, finishing up on my laboratory analysis. I apologize, my last video, I may have heard my dogs barking. I forgot I left the window open, so darn dogs. On men, of course, we want to do a PSA, a screening PSA, to make sure it's not elevated or anything that would indicate we need to do a further workup or evaluation for any prostate issues or things of this nature. And of course, that's something we follow in the beginning, maybe every couple months, and then after they're stabilized on therapy, maybe once or twice a year. DHT is very important as well. It's way more energetic and powerful than testosterone. Once again, a lot of the benefits of testosterone therapy actually come from its conversion to DHT. Kind of like estrogen, DHT is not the bad guy. It's not the devil. People worry about it. It's like, oh, my prostate's going to get big, my hair is going to fall out. Honestly, a lot of studies have shown that's not to be the case. Most of that is genetically determined, and it's really not the player. Now, if people are responding inappropriately, there's things that can be done topically for hair and things of this nature, but DHT is not something you really want to try to lower acutely, at least in the body, because again, it has a lot of effects throughout the body. There's receptors for whatever. A lot of the benefits, as I mentioned, of testosterone come from its DHT, as it is more powerful, has a lot of positive clinical effects on the body. So again, it's good to get a baseline to follow that along, and again, match that with clinical symptoms. DHEA sulfate is a good one as well. It's a pre-hormone. As we know, cholesterol gets converted into pregnenolone, into DHEA, and then further into the sex steroids. So I like to, a lot of my patients are on DHEA just to keep those normal processes humming along, especially once they're on testosterone therapy. Your body tends to make less of its own endogenous DHEA production. So I think it's a good thing. It has its own benefits to keep elevating the body. It does a lot of good things for the body in terms of lipolysis, bone, muscle health, skin health, cognition, a lot of other clinical effects too. So that's an easy one to check. A good thyroid panel, again, especially if someone's having symptoms of fatigue or weight gain or swelling, and again, it's just a good panel to get. I get a TSH, a free T3, and a free T4. Sometimes I'll get a reverse T3 as well. Again, baseline and then follow up, especially if we're going to start them on thyroid therapy. Definitely something we want to follow and track and to monitor with their symptoms. And SHBG, very important, is a whole nother topic for another day. I know I keep saying that, but this is a key thing. And there's not much you can do. I mean, there are things that herbs and different things you can do to lower the SHBG. You'll read a lot of blogs and forums saying, oh my gosh, you got to lower that SHBG because it's binding up your free testosterone. Yes, a lot of testosterone is bound to albumin and to serum SHBG. Only 2 or 3% of testosterone is free in the blood. But we're finding out a lot of some clinical effects actually when the SHBG binds the testosterone. It has its own receptor on the cell, so it actually has some clinical effects as well, which is a good thing. And a lot of studies have shown that elevated SHBG is associated with lower mortality, less cardiovascular disease, better insulin sensitivity, less atherosclerosis, and other clinical effects as well, and lower mortality. So yeah, if you want to lower, go ahead, but you're going to increase your risk of all those bad things, which is not good. So it's better to have a high SHBG, and a lot of it, again, is genetically determined. It is what it is. But the important thing is that can adjust therapy. If I have a gentleman who has a very high or very low SHBG, that's going to change how I dose his testosterone, because they may be a fast or a slow metabolizer, so to speak, and how they dispose of that testosterone, how it's bound, how it's excreted through the body. And if you have any questions, I mean, I'll talk about that on future videos, but again, that's massively important, and it's a positive health benefit. I like to get a fasting insulin on a lot of patients because, unfortunately, insulin resistance is a difficult problem. A lot of people, their insulin will go up and elevate before they have an elevated fasting blood sugar, which will pick up on the chemistry. So sometimes that's an early marker or harbinger of insulin resistance, so we can pick that up. And especially if they're having symptoms of this, if they're having problems with carbohydrates and fatigue and brain fog after meals and things of this nature. But an insulin's a great one to pick up in the beginning as well as to follow. It may completely change my therapy and what I'm going to do, both from a nutrition as well as from a supplement and hormone perspective. Prolactin is always a good screen, especially for men, because if it's really high, you want to make sure that they don't have a prolactin secreting adenoma or a tumor or anything like that. Not very common, but something that can definitely throw off your hormones, so it's a good screen to get. IGF-1 and IGF-BP3 are the binding proteins for growth hormone. The second one lasts a lot longer in the serum, but the bottom line is sometimes I don't always get these, but again, you follow clinically, but sometimes it's good to get a good baseline, especially in younger patients, and kind of follow that over time. If you have a patient on a growth hormone secretagogue or a peptide, again, it's a good one to follow. Make sure they're staying therapeutic, not too high, not too low. There are a lot of other labs we can get. Again, if a patient has other comorbidities or issues, we can dig into a detailed cholesterol panel. Not just LDL, HDL. I like to get the fractionations, the small particles, the total particle size, LP little a. There's many others that can dig in really deeper, looking for inflammatory markers, signs of neuroinflammation, other metabolites, for example, may get some urine or saliva screening for metabolisms of neurotransmitters and all the sex hormones. Sometimes we'll do gut testing, look at the microbiome, whether it's through a company like Genova or some of these other companies that do stool samples and other swabs and blood samples and urine samples that look for heavy metal toxicity, microbiota problems and things. So we can dig very deeply. We're getting in the world of functional medicine as well, which we do a lot with our patients. So this is just a quick primer on basic lab tests, and on future videos I may just talk about some of the results and dig a little bit deeper. But obviously, if you have questions, reach out to me, message me. But a good basic panel, run your results by a doc and someone who knows what they're talking about. And whether it's me or anybody else, I'm happy to answer any questions. I hope this was helpful, and everybody have a great day. Talk to you soon.